Welcome to part 3 of working with Scouts with Autism Spectrum Disorders. In this section we're going to talk about working with the family of an ASD kid and especially how to get that first relationship going, that first conversation started. You're going to find that parents of ASD kids kind of come in two categories. Some of them are going to be really maybe more social and more interested in being involved in scouting, and they'll make great scout leaders because of their compassion for kids and their awareness of their own son's challenges. You'll also find there's other families who are a little more socially detached, frankly a little more like their son, who maybe are possibly a little overwhelmed by working with their child on a day-to-day basis, and they're really looking at scouting as a respite. So you tend to either have very involved parents or barely involved parents. But either way, there's certain conversations you need to have to establish that relationship to get the boys started in scouting. So let's go on with part 3. When we talk about working with the family of an autism spectrum scout, it really helps to put some things in big picture perspective. What does that family want? What does the parents want for their son? The things that I want for my son are these 3 things. I want him to be able to live independently as an adult. I want him to be able to have a home or an apartment of his own, be able to get himself to the store, shop, take care of his own housekeeping. I want him to have loving relationships. I hope that if he wants to have a wife, he can have a wife, or at least good friendships and have interaction in his life, that he won't be holed up in a recluse. And I want him to be able to have a job. I want him to be able to employable, which means I want him to be able to interact with people in a workplace environment without being so different that it's dysfunctional, where he can hold a job and be effective in a job. So when we talk to the family, and really most of the time it's communicating with the parents, first, I want you to recognize that there will be some situations where the boy has been diagnosed with an autism spectrum disorder and other times when he will not be diagnosed with an autism spectrum disorder. Now, all that means is that nobody's formally looked at it. For your purposes as a scouter, it really doesn't matter much whether the boy has been diagnosed or not. If you recognize the traits that go with autism spectrum disorders and you use the techniques that I'm teaching you to work with a kid with autism spectrum disorders, and it's being effective, then who cares whether there's a diagnosis or not? But the reality is that there are some parents that are simply afraid of having their child be labeled, and as a result they will not seek out a diagnosis even though they know there's something wrong with their child or different. And you just have to work with that. If they don't have a diagnosis and they don't want to share that with you, that's really their business. Which brings me to the second point, which is openness. There are some families that are relatively open about the fact that their child is autism spectrum. My family's that way. We've been pretty open about it since he was diagnosed. And our rationale is that the more people who know, the more people who are understanding, the better they're going to treat him and the more likely they are to give him the helps that he needs. But not every family is like that. There are some families who they may actually have a diagnosis, and within their family they know that this particular boy has an autism spectrum disorder, but they don't want anyone else knowing that. Again, that is their choice as a parent. It's worth your while to try to probe that question with them and try to learn about it, but if they don't want to share that with you, that is their business. So, what we're going to try and do with the parents is debrief these parents to learn what are the specific things that boy needs. I'm going to give you kind of a role play here in a moment, show you what that looks like. The idea being is we want to find out what works for that kid. If they've got things that cause them trouble, we want to learn about it. If there's things that they can do exceptionally well, we want to learn about it. If there's techniques the parents have figured out for working with their son that they can share with you, we want to learn about that. During that discussion, assuming they're willing to let you know that their son has an autism spectrum disorder, what you need to do then is expand the discussion as to what other adult leaders in your unit, what other scouts need to know. In my opinion, it's generally helpful to have the adult leaders in the know, even though they may not necessarily have to publicize the fact this child is different. It's worth their while to be in the know. And especially at the Boy Scout level, you're going to have youth leaders who are somewhat older, perhaps than your ASD Scout, who would benefit from knowing that, okay, this boy's different, here's how he's different, and here's some things that you need to be aware of as a boy leader in the troop. So that's a discussion that needs to be had. Again, it's the parent's call as to how many other people know that their son has an autism spectrum disorder. And then before we move on to the role play, one last thing, which is when you're talking with parents after the boy's in the unit, please give them feedback on his successes and not just his challenges. They should be hearing at least 2 good things or 3 good things for every 1 tough thing. let's get real. They know their sons can be difficult at times to work with. They're aware of that. They do all they can. They need to be given some encouragement as well, anytime you can. I want to give you a demonstration of a conversation you can have pretty much with any parent, but it's a way for you to crack the ice and get information about an autistic kid without putting the parent on the spot and leaving them with control on how this conversation goes. So let's go to our role play. Hi, Mrs. Johnson. I'm really glad to have your son Johnny joining our troop. And one of the things we and our leaders like to try and provide the best scouting experience we can for the kids. Is there anything special or unique about Johnny that it would help us to know about, so we can work with him better and provide him a better scouting program?
Well, Johnny is mildly autistic, or Aspergers Syndrome, and which means he's a little socially inept in some situations. He doesn't quite identify with kids that are his age.
Okay, well, I'm glad you're sharing that with us, because we've got some of our troop leaders. They've been through some training to work with kids with autism spectrum, so we've got some familiarity, and we've worked with some kids like this before. If I can be a little more specific with this, is there anything about his issues, that sensory things or particular things that he has a really hard time or struggles with?
Well, yes, he doesn't like thunder at all. So
okay.
If it's really loud, or that will bother him.
Okay, so loud noises. Okay. Anything else we can talk more later, but is there anything else you can think of right now that would help us out?
Well, he kind of likes a routine. He kind of likes to do things, he's used to doing things in a certain order. So sometimes if he's kind of doesn't know what's expected of him, he's a little nervous. Okay,
I understand where you're coming from about him needing instructions and such. Okay, well, let me ask you this then. Are you okay with me sharing that information about Johnny with my other adult leaders in the troop?
Only with the adult leaders, because I don't want the boys to tease him, because he's at teenage years. That's kind of awkward.
Okay, well, that's that we can work with that. And now I can tell you from experiences that it might be practical a little later to clue in maybe one or two of my senior patrol leader might be good for him to know, but it's your choice as to whether or not we share that with him. How do you feel about that?
I think it would have to be really mature boys that are older that can be trusted, because I don't think that a 15-year-old boy has the capabilities, or at least most of them, to keep their mouth shut.
Okay, well, I'll tell you what then. For now, we won't tell any boys. Let's see how Johnny comes along in the troop, and if I think again that maybe the SPL might be good, I'll get with you first, and we can decide how we're going to handle that. Is that all right?
That's fine.
Okay.
Good.
Thank you for your time, Mrs. Johnson, and I'm looking forward to scouting with you and your son.
Thank you, Mr. Tate.
Thank you. Okay, now that was an example of a conversation that's fairly open. On the kinds of ways it could have gone is she could have told me, for instance, his symptoms but not a diagnosis. Just told me that he had trouble with loud noises and needed a routine. That would have been fine too. We could work with that just about as easily as a little more open disclosure like we had in that role play. But again, the point I want to give you is you could use this kind of an approach to an opening conversation with any parent, any scout, and probably do a lot of good learning about that boy individually. This brings us to the end of part 3. By now you've got a good handle on what ASD kids are like and what the issues are, and you've seen how you can use this approach to talk to pretty much any family. So now we're going to move on to part 4. In part 4 we're going to talk about actually working with the ASD scout himself and with the boy leaders of his unit.